Worldwide, governments imposed non-pharmaceutical interventions, NPIs, during the COVID-19 pandemic to contain the pandemic more effectively. We examined the effectiveness of individual NPIs in the United States during the first wave of the pandemic. 3 types of analyses were performed. First, a prototypical Bayesian hierarchical model was employed to gauge the effectiveness of 5 NPIs, and they are gathering restriction, restaurant capacity restriction, business closure, school closure, and stay-at-home order in the 42 states with over 100 deaths by the end of the wave. Second, we examined the effectiveness of the face mask mandate, the 6th and most controversial NPI, by counterfactual modeling, which is a variant of the prototypical Bayesian hierarchical model, allowing us to answer the question of what if the state had imposed the mandate or not. The third analysis used an advanced Bayesian hierarchical model to evaluate the effectiveness of all 6 NPIs in all 50 states and the District of Columbia, and thereby provide a full-scale estimation of the effectiveness of NPIs and the relative effectiveness of each NPI in the entire United States. Our results have enhanced the collective knowledge on the general effectiveness of NPIs in arresting the spread of COVID-19. The COVID-19 pandemic is a global pandemic of the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2-1. The World Health Organization, WHO, declared a public health emergency for COVID-19 on January 30, 2020, and declared COVID-19 a pandemic on March 11th. 2020 is still under investigation. Many early reported cases of COVID-19 occurred in December 2019 in Wuhan City, Hubei Province, China 4. Human-to-human transmission had quickly spread worldwide, and by the end of January 2020, regions and countries outside of China, e.g. Europe, South Asia, and the United States. On January 31st, 2020, the United States declared the coronavirus outbreak a public health emergency. On March 13th, 2020, the United States declared the outbreak a national emergency. All 50 U.S. states, the District of Columbia, and 5 territories declared a state of emergency due to COVID-19. With the exponential growth of confirmed cases, governments tried to utilize all resources to contain the pandemic. In addition to exploring many medical interventions immediately, non-pharmaceutical interventions, NPIs, have also been employed to reduce the infection within the population. The infection rate can be measured by the reproduction number, which is the expected number of cases directly generated by one case in a population. Table 1 contains a summary of methods used to evaluate factors that contribute significantly to the success of NPIs in various ways, and how NPIs differ significantly from one another in their effectiveness by outcomes. The outcomes include weekly average growth rate of infection of mobility rates, or death rates. Supplementary Table 2 describes methods used to estimate the joint effectiveness of NPI portfolios using the reproduction number. However, to better assist the government with policy-making decisions and to equip the population with knowledge and understanding, it is important to quantify the effects of individual interventions so that only the most effective NPIs are strictly imposed. This is important especially when the pandemic has a long time span and fatigue with NPIs sets in, and there are serious consequences on the economy, including rise in mental health and social costs. To this end, Supplementary Table 3 presents a summary of methods used to estimate the effectiveness of individual NPIs. Bayesian hierarchical models are hierarchical models analyzed using Bayesian approaches. A hierarchical model is one that is written modularly, or in terms of submodels. Rather than using classical statistics, which focuses on frequencies of events, Bayesian approaches assume that probabilities of interest are expressions of prior belief. Since the response to COVID-19 was far less coordinated within the US, different states implemented NPIs in different orders and on different days, which renders the effect of each individual NPI identifiable. Thank you for joining me on this critical examination of non-pharmaceutical interventions for COVID-19 in the USA. Stay informed, stay safe, and share your thoughts in the comments below. Don't forget to like for more COVID-19 updates, share with your community, subscribe for in-depth health analysis, hit the notification bell for updates,